Welcome to the Nicole Osei Report. I'm Nicole Osei, and today we're going to be talking about the growing measles outbreak, which has hit Texas pretty hard, and now it's spread to other states. Joining me today is Dr. Phil Wong, the Dallas County Health and Human Services Public Health Advisory Committee co-chair. Thank you so much for joining me today, Doctor.
Sure. Thank you.
Welcome. So the Texas Health and Human Services Department says about 259 cases have been reported so far, mostly in the Panhandle and South Plains region. And unfortunately, one unvaccinated child has died, dozens hospitalized. Can you first explain measles itself, what the symptoms are, how it attacks the body, and why it can sometimes be fatal?
Sure. Well, it's a viral illness that had really been considered eliminated from the United States in 2000 because we have had a very effective and safe vaccine since 1963. So it's spread by respiratory droplets and airborne. So when people cough or sneeze, it can get in the air and spread, and it causes first some symptoms like high fever, cough, red eyes, and runny nose. And then you can get a few days later a rash that starts from like the hairline and then just goes down the body. And there's also some sort of characteristic white spots in the mouth that can occur. But it can lead to some severe consequences. Swelling of the brain, deafness, and then, as we've seen, tragically, even death. But it's very preventable by the vaccine. The vaccine, again, has been around since 1963, and it's so effective that, again, as I mentioned, it was considered eliminated in the United States in 2000. Most physicians and clinicians have never seen cases of measles around. I know I've never seen it. But before the vaccine came about in 1963, there were like estimated 3 to 4 million cases per year in the United States and about 450 deaths each year in the United States. But then we haven't seen it because of the vaccine. So that's why it's tragic now that we are seeing this and that we've had a death in Texas.
And speaking of that vaccine, I was reading that the 11 counties that reported cases, 2/3 are in Gaines County, which had the highest rate of school-age kids who have opted out of at least one vaccine. Where did this anti-vaccine movement start? And can you talk about the danger that has on public health as a whole?
Yeah. Again, the vaccines are so effective, but when, in particular, if you get a group of people who are not vaccinated, then that pocket of unvaccinated population is really susceptible. And this is, the situation that we're seeing in West Texas, because, there's